All right, section 15.4, procedures and pharmacology. Diagnostic procedures for disorders of muscles and tendons, a medical history and physical examination are essential components of a diagnostic examination. Additional diagnostic tests include blood tests, damaged muscles release enzymes such as creatine kinase, CK, and aldolase into the blood, and their levels can be measured. And erythrocyte sedimentation rate, ESR, is not specific for any disease process, but it indicates the presence of inflammation, and serial readings can be used to measure changes in an inflammatory process. Electromyography, EMG, is in which an electron needle is inserted into the muscle to be tested to measure the record. Oh, excuse me. Okay, electromyography, EMG, in which an electrode needle is inserted into the muscle to be tested to measure and record the electrical activity in that muscle as the muscle is contracted and relaxed. Nerve condition studies are used to measure the speed at which motor or sensory nerves conduct impulses, and also can show problems at the neuromuscular junction, for example, in myasthenia gravis. Magnetic resonance imaging, MRI, and computed tomography scan, CT scan, can show detailed images of damage or disease in muscles. Ultrasonography can identify tears and inflammation of tendons and involves no exposure to radiation, unlike MRI and CT scan. Muscle biopsy, BX, is performed by removing a small piece of the abdominal muscle through a hollow needle or small incision to be sent to the laboratory for examination and analysis. Oh my God. Genetic testing of blood tissue or tissues can show the mutations in some of the genes that cause the different types of muscular dystrophy. Myositis specific antibodies, MSA, can confirm a diagnosis of dermatomyositis or polymyositis. Dozens of these antibodies have been identified, and research is ongoing to define their significance. So antibodies, the protein in response to an antigen. Biopsies, removal of a tissue from a living person or laboratory examination. For laboratory examination, creatine kinase is an enzyme elevated in the plasma following heart muscle damage. Electrode, a device for conducting electricity. Electromyography, recording of electrical activity in a muscle. Enzyme, protein that produces change in other substances. Erythrocyte sedimentation rate. The speed at which red blood cells sink from drawn blood, and inflammation, a basic complex of reactions in blood vessels and adjacent tissues in response to injury or abnormal stimulation. Ultrasonography, delineation of deep structures using sound waves. Therapeutic procedures. Physical therapy is a profession dedicated to the treatment of functional impairments, decreased mobility, and pain. Physical therapy is widely utilized and supported by research as a successful course of treatment and rehabilitation for individuals of all ages. Physical therapy utilizes a wide variety of interventions to help patients. Therapeutic exercise is a systematic, progressive set of exercises that a PT designs for each individual's needs. These exercises are designed to foster rehabilitation, maintain or increase range of motion, and decrease pain. Therapeutic exercises are classified according to the purpose of the exercise being utilized. Primarily, these classifications are range of motion, strengthening, postural balance, and coordination and flexibility. Manual therapy, so dry needling, is a treatment performed by a PT certified in the procedure, also referred to as intramuscular therapy. A thin monofilament needle penetrates the skin to treat a specific muscle. Dry needling can reduce pain in active trigger points and inactivate trigger points and target issues that are not manually palpable. Typically, dry needling is one component of a broader treatment plan incorporating other physical therapy interventions. It is important to note that dry needling is not acupuncture. Acupuncture is a practice based on traditional Chinese medicine and performed by licensed acupuncturists. Dry needling is an evidence-based intervention using modern Western principles of medicine. Alright, so did you know physical therapy is one of the fastest growing medical fields? The employment of PTs is expected to grow 18% between 2019 and 2029. Demand for physical therapy is increasing from aging baby boomers who are staying active later in life. Chronic health conditions relating to aging such as strokes, back pain, and knee pain, knee and hip replacement. In addition, PTs will be needed to treat mobility issues stemming from chronic conditions. Cupping therapy. Alright, so cupping therapy is a modality sometimes used by PTs for treating painful musculoskeletal issues. It uses a pulling effect on the fascia and underlying muscles to improve tissue extensibility, decrease fascial restrictions, treat muscular trigger points, and temporarily increase circulation. Soft tissue mobilization and myofascial release. Fascia is the connective tissue that surrounds all the organs and muscles in the body, holding them in place. Myofascial release is a therapy used to release tension in the fascia and improve the mobility between the different fascial planes in the body. Soft tissue mobilization is an intervention PTs use to treat areas of increased tension in muscles and tendons. It can be used to treat trigger points, areas of pain, scar tissue, and reduced mobility. Both myofascial release and soft tissue mobilization are typically performed using manual pressure provided by the therapist's hands or fingers. Instrument assisted. Sometimes tools can be used to assist the therapist in soft tissue mobilization or myofascial release. These tools are used to work on soft tissue such as muscles, tendons, and ligaments to promote healing and tissue regeneration. Instruments are often utilized when soft tissues have significant scarring, injured or dysfunctional, or when mobility is restricted. Muscles are comprised of thousands of fibers which in healthy and normal muscles run parallel to each other. Sometimes when there is injury, damage, or dysfunction in the muscle fibers will no longer run in the same direction throughout the entirety of the muscle. The use of tools on a dysfunctional muscle can help to strengthen those muscle fibers back out to restore normal movement and function of that muscle. Instrument-assisted soft tissue mobilization can be practiced by any PT. But there are also special certifications including ASTYM and Graston technique requiring continuing education. Physical therapy modalities. Physical therapy modalities refer to the use of electrical, thermal, or mechanical energy as a treatment technique. Electrical stimulation. Electrical stimulation, E-stim, is a common modality used to address pain. Electrodes are placed on the targeted area and electrical pulses are sent through the skin. These electrical pulses can interrupt the normal transmission of nociceptors in the area, providing some pain relief. Interferential current therapy, IFC, is one type of E-stim which uses a frequency sweep pattern to prevent the body from accommodating to the stimulation and therefore extending its effectiveness. Occasionally, electrical stimulation is used to cause muscle contractions intended to preserve or increase muscular function. These treatments are typically used in patients with a significantly impaired ability to contract the muscle independently. If a patient can actively contract a muscle, this is almost always a superior method of strengthening to electrical stimulation. Thermal modalities. Thermal modalities use heat or cold to produce an effect in the targeted tissue. The use of heat can increase blood flow and extensibility of the targeted area. This can be particularly useful for areas that are avascular, very limited blood supply, to increase healing and repair. Colds can be used to limit swelling by reducing blood flow to an area and slowing the inflammatory response. Inflammation is needed for injury repair, but also increases pain due to the release of certain cellular messengers known as cytokines that can trigger nociceptors. Inflammation can also impact surrounding healthy tissue, which is why cold therapy is important. Ultrasound. An ultrasound machine is the physical therapy setting. In the physical therapy setting, utilizes a sound wave to mechanically cavitate the cells in a targeted area, creating a deep heating effect. Typically, this is not felt by the patient as the sound waves have little impact on the cutaneous nerves as they pass through to heat the underlying tissue. Occasionally, if the ultrasound wand is left too long over a bony area, then the buildup of sound waves along the periosteum can produce a sharp spike of pain. This pain dissipates as soon as the wand is removed from the area. Musculoskeletal drugs. NSAIDs inhibit the two cytooxygenase COX enzymes that are involved in producing the inflammatory process. They have analgesic and antipyretic effects and are used for treatment of tissue injury, pyrexia, rheumatoid arthritis, osteoarthritis, gout, and nonspecific joint and tissue pains. The three major NSAIDs, each of which is available over the counter, are aspirin, so acetylsalicylic acid, aspirin, which in addition to the above effects and uses has an antiplatelet effect due to its inhibition of one of the COX enzymes. What's COX? Okay, one of the COX enzymes. Thus, it is often used in the prevention of heart attacks. Second, we have ibuprofen, like Advil, Motrin, and several other trade names, which acts by inhibiting both the COX enzymes, essential elements in the enzyme pathways involved in pain, inflammation, and fever. It is taken orally, but in 2009, an injectable form of ibuprofen, Caldolor, was approved for use. In some studies, ibuprofen has been associated with the prevention of Alzheimer's and Parkinson's diseases, but further studies are needed. Naproxen, like Aleve and other trade names, which is taken orally once a day, also inhibits both the COX enzymes. Did you know spasticity is a state of increased muscular tone with exaggeration of the tendon reflexes? Indomethacin, an NSAID that inhibits both COX enzymes, is a potent drug with many serious side effects. It is not used as an analgesic for minor aches and pains or for fever. Paracetamol, acetaminophen, an active metabolite of phenocetine, not an NSAID, is a widely used over-the-counter analgesic and antipyretic. It is used for the relief of minor aches and pains and is an ingredient in many cold and flu remedies. Skeletal muscle relaxants are FDA approved for spasticity, baclofen, dantrolene, tizanidine, or for muscular conditions like multiple sclerosis, carisoprodol, chlorzoxone, cyclobenzaprine, metaloxone, methylcarbamol, or phenadrine. The only drug with available evidence of efficacy in spasticity is tizanidine, Xanaflex, Cyrilide, but cyclobenzaprine, Ambrx, appears to be somewhat effective. Anabolic steroids are related to testosterone but have been altered so that their main effect is to cause skeletal muscle to hypertrophy. They are used illegally in many sports to increase muscle strength. They have marked, often irreversible side effects, including stunting the height of growing adolescents, shrinking the sperm counts, masculinizing women, and causing delusions and paranoid jealousy. In the long term, there are increased risks of heart attacks and strokes, kidney failure, and liver tumors. So, anabolic steroid, prescription drug used by some athletes to increase muscle mass. Analgesia, state in which pain is reduced. Analgesic, agent that produces analgesia. Antipyretic, agent that reduces fever. Cytokine, a hormone-like protein that regulates the intensity of immune response. Ingredient, an element in a mixture. Metabolism, the constantly changing physical and chemical processes in the cell. Metabolite, any product of metabolism. Ultrasound, very high frequency waves.